everyone. My name's Wendy Trevathan and welcome to our podcast, Your Nurse Voice Matters. Great to have here today Claire Kelly. How are you going, Claire?
I'm really good, thank you. Thanks for having me.
You're more than welcome. So, Claire, I'm excited about today. We've just, before we came on, shared a few similarities in our backgrounds, and very exciting to see how our nursing paths weave in and out from our mutual contacts. It's wonderful.
Yeah, it's exciting. Yeah.
So, just a few words of introduction for Claire, for those that don't know her. So, Claire is the founder of Healthy in the Middle and Cancer Wellness Coach, offering education, coaching, and consultancy in cancer support and women's health. A registered nurse and an accredited health and wellness coach, she also holds a Master of Public Health and postgraduate qualifications in oncology, palliative care, and menopause. Claire's extensive career spans executive management, director of nursing, and clinical nurse consultant roles across Australia and in the UK. Recognised as one of the top 10 cancer nurses in the UK and a founder of the United Kingdom Oncology Nursing Society, Claire has authored the Health and Wellness Cancer Coaching course for Wellness Coaching Australia. Congratulations. She also leads programs for women navigating menopause, cancer, and chronic health conditions. A passionate advocate for evidence-based care, Claire delivers workplace education and bespoke health programs, empowering individuals and communities to navigate health transitions with confidence and support. Wow. That's quite a short summary of a very extensive career.
Sounds a lot,
Congratulations.
doesn't it?
Wow, I was really keen on seeing the Health and Wellness Cancer Coaching course with Wellness Coaching Australia, and we commented about that before we came on. So I'm going to go right back to the beginning, Claire, if you don't mind, take you back on a
Yeah.
little journey to when you were considering becoming a nurse. And if you can just share with our
Mm.
audience, what actually made you become a nurse?
Oh, well, I think what made me become a nurse was I hadn't ever thought about doing anything else. I don't think it was a case of a huge desire to be a nurse. I just only ever remember that's all I ever wanted to be. Um, when I was at school, I definitely did not apply myself as well as I could have done. And I think part of that was knowing that I wanted to go into nursing. And back in the day, it was a different process. We didn't have to go to university. That wasn't why I wanted to go into nursing. I guess my earliest memories of seeing and understanding that that would be quite a good work life for me and a good career for me was, from being very small, very young, and putting eye drops in my grandfather's eyes when he had glaucoma,
Mm.
um, to an accident in my home, of a family member who got quite a nasty head injury with a large laceration. And I was probably about 13 or 14, and I don't know why, but just innately knew what to do and didn't panic, whilst everybody around me who was older than me, including my mum, panicked. And, you know, and I guess the observation and the comments at that time, being quite young, was, oh my gosh, not only was I quite calm, very calm, but innately knew what to do and felt quite comfortable doing it. So I guess, yeah. And career advice meetings at school never lasted more than 2 minutes, because they go in and say, what do you want to do? And I'd say, I want to be a nurse. And they'd say, okay, then. So that was it.
That was it. Back in the day, it was either a nurse, a teacher, or a mum.
Yeah, or a secretary.
Or a secretary. Yeah, my mum was a private secretary. So it sounds like, nursing was in your veins and, you had a situation there where your natural ability, picked up on that. And it's wonderful to hear that you're calm, because a lot of people, when they're faced with a situation like that, that's the first thing that they do is they freak out because and it sounds like you had a natural ability. So let's move you forward. I'm guessing, did you train in Australia or the UK?
I trained in the UK
Mm.
in the last few years. So it was at the end of the 80s, 1987 to 1990.
Mm.
And then the university standard for all nurses came in shortly after. So I was one of the last, probably the last 2, 3 years of hospital trained cohort where we spent all the time learning on the job,
Mm.
which I'm very thankful for.
That's it. You learn it in school, and then you go out and practice it on the
That's
ward.
right.
It was actually
Yeah.
it flowed really well. Um,
Yeah.
okay. So, what were your early years like? What did you go to a particular area? Did you find
Mm.
your feet in a particular
Yeah.
area of nursing?
I loved my training. Oh, happiest days of my life. I just loved it. I loved going to all the different places, going into every specialty. Interestingly, never did oncology in my specialty. You'd got to do a specialty in your third year. Um, and it wasn't somewhere, it was not an area that I explored at all. Um, I thrived in emergency. So I I was not a very academic at school, and I found my desire to learn as soon as I entered into nursing, and really had never received an awful lot of recognition for my abilities. I just was kind of always under the radar. And when I was in ED, I was getting feedback that I had a good skill set in that environment. So I just loved it. I thrived in the chaos and the unknown things coming through the door. And certainly what I did love about ED was the diversity of people, which you got on every placement, but particularly in emergency. And that was my plan to work there. So when I finished my training, I actually applied for a job at a hospital in a different city in the UK, in Manchester, because they were about to open one of the biggest ED departments. So off I went. But the only job they had, because you were employed at the hospital in those days, not necessarily for the role. And I wanted to go to this particular hospital, Manchester Royal, and off I went. And they said, "We've only got a job for a new staff nurse in hematology. Do you know what that is?" And I said, "Yeah, that's," I had no clue. They said, "That's hemophilia." And they said, "Well, it's actually hematological malignancies and bone marrow transplantation." So I went there, learned all about bone marrow transplants, hematology nursing, leukemia, lymphoma in a bone marrow transplant unit. On my first week, I went down to ED to tell them that I was here and I was ready for a new staff nurse job. 6 months later, I got contact from the sister in ED who said, "We've now got some staff nurse positions." And I was hooked on my hematology work.
Mm.
And I was like, "Nah, I don't want to go to ED." So
Ah, that's amazing.
yeah, and I stayed in oncology. Well, I stayed in hematology for, and oncology for what, 35+ years in very different settings, from every setting. I've done private, public, hospice nursing, education, research, director of
Mm.
nursing, strategic health authority, but always within lots of cancer charities as well, but always within the scope of cancer and palliative care. So,
Mm.
it's been a long
Been your
and
thing.
extremely rewarding career.
Mm. So over those years, I mean, hematology nursing has changed so much
Mm,
since those early days, and the amount of treatments and things that they've produced and they're able to do now.
mm,
Even with like investigating the hematological diseases, it's
yes.
the whole landscape's changed so
Yeah.
much since back then. What do you
Yeah.
think has been the biggest change that you've seen?
Oh, I mean, not so much in nursing, but in treatments. The one thing the one area that draws my attention to a question like that is the treatment is melanoma. I remember years ago when I worked in a medical oncology ward, and I remember I used to think, "Oh gosh, you had somebody with metastatic melanoma." It was a really, really difficult situation and really quite sad and challenging, complex to manage. Um, and very poor access to treatments that really didn't have good outcomes at all. And then in 2023, I was working as the National Support Manager for Melanoma Patients Australia on the back of, and actually prior to that, for the last, 6 years before that, working in an oncology unit in Brisbane delivering immunotherapy to patients and seeing this amazing response to melanomas from immunotherapy. So I think that the biggest thing I've seen is increase in survival on the back of really different treatments. And interestingly, when I did my master's back in the year 2000, I did it in public health. Um, and it's very interesting that I feel like I've gone a full circle because I've always had this real interest in public health, and here I am, looking at kind of prevention and of very interested in health and wellness and actually preventing cancer in the first place.
Mm.
And I think I see through a much broader lens now of the whole picture of oncology, but actually how nurses can work, how we with our skill set can work in that prevention space as well.
Mm.
Um, yeah, so I think the survivorship has been the main thing. I've seen some other big changes in the way that services are delivered, which is probably a whole different hours conversation.
It is. You could go on. I was just going to make a comment, with regards to the treatment that a large proportion of my background with cancer was in radiation oncology, and the evolution that I could see from when I first got introduced to that, and I fell into cancer nursing as well. I didn't have it in
Mm,
my training, but in the radiation treatments, how much focused they are now. It's, the
yes,
technology has really preserved a lot of tissue, a lot of
that's right.
very pinpoint treatment.
Yeah,
So for me, that's been the biggest
yeah,
evolution. But you're right, like when you're working in that area, you kind of reach a point where you're scratching your head and you kind of go, we need to prevent these things from happening rather than treating them when they
that's
do.
right.
And it's really interesting at looking at both of our careers, how we've probably had that sort of epiphany happen at a certain similar point and gone,
Mm,
yes, we do need to go to the front end and have a look
yes,
at preventing. So let's talk a
yeah.
little bit about what that journey was like for you. Like, I know that you've done a few things, but you tell us how that evolution happened and what you're doing.
Moving out of nursing into,
Mm.
yeah. So, well, it's been very interesting, and it's still, a work in progress. And it's been quite organic. So it's not a heavily thought through process of transitioning. I love the word transitioning. I mean, that is in essence the space I'm working in. I'm working with clients who are transitioning through their own health experiences. So,
Mm.
I actually like to call myself a health transition, because that's exactly what it is. In terms of my own experience, I think if I can be honest with myself, which some days I can and some days I'd rather not be, I think I probably burnt out at the end of COVID. I think COVID was probably not the only trigger. I was working in an environment that was particularly challenging, and I think after doing oncology nursing for 35 plus years, and never looking after myself and prioritizing the needs of everybody else, that comes at a cost to your own health. So I also experienced menopause and a surgical menopause, and that led me to go and study menopause because I wanted to know what I was letting myself in for. Um, and that led to a bit of an epiphany of how disappointed I felt in my lack of support to all of the many women I'd looked after who had a chemotherapy induced menopause,
Mm.
and the lack of support, information, and care that I had offered to these women out of ignorance of not really understanding or appreciating it. And that's not my only my responsibility. It's never been part of an oncology nursing curriculum.
No.
It's not something we consider.
Mm.
So I became extremely passionate about that. I wanted to advocate for that and try to fill a hole. And I was in a situation where I left a clinical role to go and work for a national charity, and then as a support manager, and then that contract finished, and I really wanted to just take some time out to explore this whole notion of menopause and cancer a little bit deeper. I had also, in that thinking, decided that I really wanted to work. I think in oncology, after a while, you get to the point that you realize, well, I did, that it's not about fixing people. It's not about always providing a therapeutic intervention. It's about being alongside people and helping them find their own skills for them to progress forward. It's not really what we can provide in that supportive care role. It's it's empowering them with their own skill set. And that really has always appealed to me in oncology. And I came across health and wellness coaching and that model, which is very different to a nursing model. We like to kind of fix things that are broken, whereas coaching does not regard people as broken,
No.
but as benefiting from some guidance, some direction, some support. That whole model of coaching really, really appealed to me. And I think I'd probably been unknowingly working with some of those coaching concepts anyway in my clinical practice. And so it felt like a natural, it felt really like the right thing for me next to go into the health coaching space. And there was a little bit of a risk there in that I have to do that privately. It's not funded by um, there isn't an item, Medicare item for people to be able to claim that. So it is a bit of a risk in that you've then got to be a little bit entrepreneurial in, developing a business. And really, when I look back on probably 80% of the roles I have had in nursing, and it only dawned on me after I've been doing this for about a year, that every single nursing role I have been in, I have been appointed, or at some point in that role, I have been required to set up a new service.
Mm.
So really, there's so many parallels with a career in nursing, setting up new services, because
Yes.
you wouldn't have done that in a 30-year nursing career.
No,
Um,
it's an acumen that you take on board as part of your role, but you're not consciously aware that you're actually developing that awareness of how all that works, how the
yeah,
cogs in the wheel work to be able to put
yeah,
something together. Yeah,
yeah,
definitely.
So I'm basic. So I mean, I worked for Cancer Council. I worked for Melanoma Patients Australia. Or I've worked setting up a cancer care coordination model of care at the Mater in Brisbane, and all of those services are really what I've been creating. That they've all contributed to me being able to create a model of care for supporting people now in a cancer space. So what I'm doing now is I'm actually supporting and coaching and delivering education and working on contracts where opportunities come up where I've got the right skill set to support individuals or organizations through that health transition, which is typically menopause, cancer, or both of the above, menopause and
Mm,
cancer.
mm.
Um, yeah, and it's still very organic. I'm actually working part-time as a director of the Advanced Breast Cancer Group in Australia, which is a metastatic breast cancer service, which has been around for 25 years. So their previous leaders have retired and I've stepped into that role to continue to support that service. So I've still got in a little bit of something that's not brand new, which is nice.
Mm.
And I think back to that, it's really interesting. I hadn't thought about this, but back to that um reflection on why I loved emergency and all the different things, and I guess nursing, you're never just doing one thing. It's
No,
so
you're
diverse.
juggling many balls in the air. Yes.
Yeah, yeah. And in nursing, we're always educating, but we're also delivering support, but we're also, managing a service. And I guess that's where I've landed, but it's just me, most of the time.
Mm.
So yeah, I'm just not ready to retire
You've got too much
anytime
work to
soon.
do.
Yeah.
Too much work to do. I was going to say, like the theme of this podcast is to obviously inspire, which you've done with what you've done and what you're doing, education, and also sharing. And I guess along the sharing vein, having done so many things in your career and managing, a mixed portfolio at the moment, what would be your advice to nurses that, they want to make a difference and they want to do more than what's in front of them? What advice would you give to those nurses?
I think for me, nearly everything I've had the opportunity to do, which has given me that has led to doing a little bit more than the, every day, just doing the, Groundhog Day or whatever, is always having the desire to advocate for my patients. I think, if you, for me, going into work not to, you know, do X task X number of times or to put, support 30 patients through clinic or whatever that looks like, or to have a bay of 3 bays of, 6-bedded bays or whatever. It's always to understand the patient experience and to advocate for their needs. I think that is becoming a more important notion in nursing because I think that it's hard. It's hard out there for nurses to, we're resource poor. Um, there's often challenges to deliver the care we want to deliver. But I think when we advocate for what patients truly need, I think that's sometimes when we start to see change.
Mm.
But you have to use your voice and use it in a really, positive way. I think we need to be taught how to manage up um, and how to bring the patient voice to conversations with our managers, with our leaders. And I think the most important thing, if I was, talking to a nurse who was new into the profession, is, do you remember I mean, I know they still do care plans, but I remember years ago, sitting as a student nurse writing care plans for my patients, and it was a little bit standardized.
Mm.
And we can't do that. Like, I think the one thing I've learned about nursing is that every single patient is, well, we know that, don't we? But I think sometimes we need to be reminded that every patient's unique.
Mm.
You can't have a standardized care plan. You can have some core fundamentals to keep them safe and to make sure they get the outcomes they need with treatment, etc. But we have to look at the person.
Mm.
That's my passion, to truly look at the person. And I think what we also need to be very mindful of is that every nurse is as unique as every patient.
Mm.
So every nurse's capacity to deliver excellent care or a particular way of delivering care is going to be a little bit different as well. So we need to be mindful of that whether it's you, Wendy, or myself, or a junior nurse supporting somebody to tell them about what's going to happen with their chemotherapy, we're each going to do that differently. We've got to
Mm-hmm.
have some basics that we all meet. Um, but let's put the patient at the center of it. And I think I wrote something to you on the preparation conversation we were having around the art and science of nursing, but I
Yes.
like to change the art and science of nursing to the heart and science of nursing, because I think that if we can apply the heart
Mm-hmm.
to the science, we can't go too far wrong.
No, that's right. And we advocate for patient-centered care, but we need to action it and
Yes,
and put it at the center of everything. And
that's right.
that goes above and beyond checklists, meeting demands, time pressures,
Yeah,
urgencies. It's the number one thing. So that's really good
yeah,
advocacy for our junior nurses that are coming through, is to really stop and think. And when I was doing clinical education, I always used to say to the students, imagine that the person in front of you is your mother, brother,
yeah,
father, sister, auntie, uncle. Imagine how they would like to be treated, how they'd like to be spoken to, the standard of care that they expect to receive. And that's what we should be delivering
yeah,
to those
absolutely.
people. Yeah.
It's an important lesson. It's foundational, isn't it? And I remember being told the same as a student nurse,
Mm.
to treat people like, like they were my family. And I think that's a great benchmark to a great standard to set.
Mm. Yes. So, Claire, anyone that's listening today, they'd like to reach out and find out more about what you're doing and talk to you. What's their best point of contact for you?
Probably send an email to me at claire@cancerwellnesscoach.com. Or if they're on LinkedIn, they can find me on LinkedIn. There's probably a lot of Claire Kellys on LinkedIn.
Excellent. So we'll put those details in the brief about this podcast for you. And any last words of wisdom that you'd like to impart?
Oh, I just think, I suppose, wisdom, never underestimate the privilege of nursing, and the enormous value that we have the potential to bring to, really stressful moments and poignant moments of people's life. We have a real opportunity to make a massive difference, and that's what it's all about.
Thank you. And hence the reason why this podcast. So if you know anybody that would like to participate on this podcast, put them forward, because I'd really like to meet up with them and just see what they've got to say. And this is exactly why the podcast is here. So you'll be listening to Your Nurse Voice Matters. My name's Wendy Trevathan. Thank you so much for taking time out of your day, Claire, to be here today.
Thank you for having me. It's been fun.
And we'll see you on the next episode. Bye for now, everyone.